So looking at your journey as Commissioner of State, what?
It was in place and it had been signed first. And even when the administration was built to review the health sector and make recommendations. So for me, all I had to do was to look for this there that you could hold on to and start to push. My colleague has been talking about how do we switch on our need to make sense. Sometimes you personalize it. Someone's pregnant and catch a helicopter back to find. We should always sit together and map out what I call and push it repetitively until it sinks, and then they will understand the message. And this sometimes is just a signature that you need, an approval. For the money to be released, activities are happening, and people are getting impact for the money that has been budgeted for.
Thank you. Should I test your knowledge from the lecture you just heard? What's SOCO? Who wants to tell me what SOCO is?
Communication objects.
Okay, so thank you so much, Dr. Obi. We'll come to the audience. Are there any questions? Okay, so I'll take only those three. Only 3 questions. Yay, I saw her. Yes, I saw her. So let's start with her, yes.
Oh, sorry.
Yes, please ask your question. Yeah.
Hello, everyone. My name is Helen. I am the National President of Deaf Women Association in Nigeria. Thank you for this discussion. It was a strong panel. And I'm also interested in this area of healthcare because accessibility is important for everyone, especially people with disability. You also pointed out that you people are doing well in your various states. Do you have accessible health care in your state? We have 30 million persons with disability in Nigeria. So how accessible is your health care services in your state? For example, many deaf women would prefer to give birth at home and die in the process because whenever they go to the hospital, there are no sign language interpreters in any hospital in Nigeria. That is because of no communication in the hospital. When it comes to insurance, some of you explained that that you would make plans for some group of people to have full insurance scheme. How are persons with disability benefiting from this? Have you captured persons with disability in this insurance scheme that you're planning for a certain group of people? Finally, remember that the President has passed the National Disability Law, and we have a 5 years implementing grace. So what we will just advise the panelists, the Commissioner of Health, is try and implement this. Not because deaf people cannot access healthcare services, but because the communication barriers are there, and nobody is addressing it. I am a mother of 4, and I knew how difficult it was for me to access ANC. I almost lost my life. So please, let's put this into consideration. Thank you.
Thank you so much. Thank you. The panelists will respond shortly. Please give it to me.
Okay, thank you. My question, well, from the Lancet Commission, we discovered one of the weaknesses in Nigeria is governance. And a lot of things are done on ad hoc basis. So 6 years after we have the National Health Policy, 2016, I don't know how many states have domesticated this policy. Because if they've not domesticated it, it means basically you don't have policies and then working on ad hoc basis. So what is the challenge for the states to have state health policies? And if you don't have state policies, what then drives what you do? So I think that's for all the commissioners. Who are you waiting for before you domesticate the state policies? And then I think from Kaduna, it was very interesting to hear about what you're doing to address the social determinants of health. You're actually mainstreaming health in all sectors, which is fantastic. But so the same similar question. Do you have any formal strategic document for this mainstreaming health in all sectors? Or will these initiatives go with you when you leave office? Thank you.
Thank you, Prof. Yes, please give it to him. Last question.
Good afternoon, everyone. Zachary Siaka Oshaku is my name. I work for PHC Initiative Africa. First of all, I want to commend the Honorable Commissioner of Health, Kaduna State and Akwa Ibom, right?
Cross River.
Cross River. With the introduction of the use of drone technology in administering health commodities. But my concern is, how do we ensure, because I know it's very expensive, because I was privileged to have a meeting with some of the officials of Zipline in terms of operationalization of distributing health commodities to hard-to-reach communities. So my question is, how do we ensure sustainability and scalability? Because part of the reasons why many states have not keyed in to this welcoming, innovative idea in administering health commodities is the cost implication. So have you done the cost-benefit analysis of using this technology? That's my question. Thank you very much.
Thank you. We have one last question. You have exactly 1 minute to ask your question, please. One minute.
Hello all. Good afternoon. My name is Fatima. I have a question to ask, please. Despite the recognition of the importance of health to everyone, why is the cost of accessing healthcare getting out of reach of all the poor? How can they make it more affordable to all? Also, for those of us who are government workers, we are made to go for NHIS, National Health Insurance Scheme. With that one, when you get to the hospital, they still will ask you to pay for certain things, telling you that not everything is covered by NHIS. So why is it so? The cost of health care or accessing health care is becoming too poor. There are so many people who are sick, but they cannot go to the hospital because they cannot afford it. Since it is a primary issue in every society, it is very important that the cost of accessing health should be very, very low so that everyone can have it. Thank you.
Thank you so much. The age-old question. When are we going to achieve